PRP for knee arthritis, questions and answers. So, what is PRP and how does it work for knee arthritis? So, PRP stands for platelet-rich plasma. It is a treatment made from your own blood. We draw a small sample, spin it in a centrifuge to concentrate the platelets, and then we inject that platelet-rich portion back into the knee. So how does it help arthritis? When PRP is injected into the knee, the growth factors interact with the remaining cartilage to help to regenerate cartilage to some degree. Now, it is not a 100% regeneration, and the cartilage regenerated will be more of a fibrocartilage, which is really a combination of cartilage with fibrous tissue. So it is not the same exact original cartilage that was in the knee before. So, it is important to know that PRP does not regrow a brand new knee or cure arthritis, but many people use it to reduce their pain symptoms and to delay the onset of severe arthritis. So, who is a good candidate for PRP or platelet-rich plasma injections? So, PRP is used typically for those who have arthritis, and it is best used in those with mild to moderate arthritis. In severe arthritis, or what we call bone-on-bone arthritis, I would not recommend PRP for this type of arthritis because PRP needs some sort of residual cartilage in the knee joint to actually work. So in mild to moderate arthritis, there is some residual cartilage for the growth factors to interact with to help with the regeneration of the knee cartilage. When it comes to bone-on-bone arthritis, knee replacement surgery may be discussed with a surgeon, or in some cases, even trying a gel shot into the knee that is bone-on-bone arthritis may possibly help to alleviate some of the pain and possibly delay knee surgery. Now, who would not be a candidate for PRP injections? So, some reasons a person may not be a candidate for PRP or may need to delay a PRP shot will be an active infection at the knee joint or anywhere about the body, certain blood platelet disorders or severely low platelet counts, uncontrolled medical conditions. If the person is also on blood thinners, there are bleeding risks that may be associated in this situation. If you are on blood thinners, you are not to stop these blood thinners without first consulting with the doctor that first prescribed them. Remember, steroids are anti-inflammatory, and when you inject the platelets into the knee, you actually do want a good inflammatory reaction to help with the healing process. So if you did a recent steroid injection into a knee and the inflammation is now suppressed, and now you inject a PRP solution in there, and then you inject the PRP into that same knee, what may happen is that the PRP may not cause the proper level of inflammation or healing inflammation to help to regenerate the cartilage. So if you have done a steroid injection, I suggest you wait at least 8 weeks before doing the PRP into that same knee. So, how effective is PRP for knee arthritis and what can you realistically expect? So, if you have mild to moderate arthritis, you can expect to get some degree of pain relief with PRP. However, once again, if it is bone on bone, you're unlikely to see any benefit from a PRP injection. Now, as with any injection, to get the most out of it, you really need to also add physiotherapy. If you're overweight, you may need to lose weight as well. Remember, the additional weight is going to put more shear forces on the knee joint. So, losing weight would help the PRP to work better. Also, when you do physiotherapy, you strengthen the knee joint. Also, as well, you give the knee joint more mobility. There's less stiffness and there's less pain. Some people may need to wear a knee brace to support the knee. Also, as well, if you have any foot issues such as overpronation or supination, you may need to change your footwear so that the foot is realigned so that you take pressure off the knee that is being treated. How long does it take to feel relief after you do a PRP injection? Now, here at the clinic, we do the PRP as 3 shots. Each shot is done 1 to 4 weeks apart. Some people may begin to feel relief after the first shot. However, some people may need to complete the course and after the 3rd shot, even wait a couple weeks after that to begin to notice relief on the knee. How long does pain relief last from PRP? It could possibly last between 6 to 12 months, but once again, each person is an individual case. There are many factors that will affect how long it is you get pain relief for, and also as well the degree of pain relief that you do get. Now, it is also common to experience some pain on the knee after the PRP injection. This happens because the natural inflammation that takes place can cause some pain or discomfort. To deal with that pain, you're not going to take your typical NSAIDs, because then this is going to suppress the natural inflammation in the knee that you do want with the PRP. So what you would normally do in a case like this, possibly take paracetamol or even tramadol. Pain medications do not have an anti-inflammatory effect that will then fight against the PRP in the knee. However, there are some red flags that you should look out for. As with any medical procedure, there are risks. So if after you do the PRP, there's a worsening of the swelling, if there's fever, if there's increasing redness or warmth on the knee, you may need to come back in to have the knee re-examined and possibly have the knee drained. how long do PRP injections last, and would you need any repeat injections? Now, with the PRP, yes, you may need to have repeat injections. The pain relief from PRP may last between 6 to 12 months, but once again, it is very individualized. Each person different. Each person comes with different degrees of pain. Each person comes with different levels of cartilage wear and tear, as well as to one person may be overweight, the next person may have normal weight. So again, it all depends on your initial situation. How many PRP injections are needed? At the clinic here, we do it as 3 shots. So you'll come in, you'll do the PRP on one day, you'll wait between 1 to 4 weeks, do the second PRP, wait 1 to 4 weeks, and do the third PRP. After that, then we monitor you and we follow up how the pain levels are progressing. And you should expect to get the maximum amount of pain relief around 6 weeks after the third shot. As well as we also recommend that you do physiotherapy to help to strengthen the knee joint and to really maximize the PRP. Additionally, if you're overweight, we advise that you lose weight to help to reduce the wear and tear on that knee joint. So how is the PRP procedure performed and is it paid for? Okay, so when you come in, we draw blood from the vein in the elbow here, put it in a special tube. We put that tube in a centrifuge, we spin the centrifuge, and we separate the blood into 2 main layers. We have the plasma on the top, and then the red blood cells are trapped at the bottom. Then the plasma is pulled up and put into a syringe. The knee is cleaned with alcohol and iodine. We use a cold spray to numb the skin, inject some lidocaine to numb the skin as well, and then the needle with the PRP is then injected into the knee joint. There is some discomfort. It is not painless, but we are using the free spray and the lidocaine to help to minimize the amount of pain that you do feel. When the PRP goes in, you feel a sort of a tight sensation in the knee. When you get up and you begin to walk around your room after the PRP is injected, your knee would feel heavy, it might feel a bit numb, it may feel a bit tight. That is normal. You give it some time, and then you allow the knee to accommodate that additional fluid that you have put into the knee joint, and then it begins to feel a bit more normal after that. Also as well, it is a procedure where you can drive home. You don't necessarily need to come with a driver, but if you want to, it is fine. But know that you can walk out the same day. When you have done the PRP on that day, you just take it easy for the next couple of weeks. You don't do any unnecessary activity. You hold back from your gym activities, any hard work. You just do whatever activities are needed for life. So what are the risks or side effects of a PRP injection? So you would expect to get some soreness or stiffness or even increased pain on the knee joint. There might be some mild swelling, some mild warmth or feeling of pressure in the joint. In terms of risk of doing the PRP, there is a possibility that the joint could get infected. There may be some bleeding or some significant bruising around the area. There may be some blood vessel injury as we do the injection. For example, if we puncture a vein, a superficial vein, while going into the knee joint and it begins to bleed, we simply just compress the vein and allow the blood to clot. Now, in terms of allergic reactions, it is uncommon that you will get an allergic reaction from PRP because it is your own blood. You may get some allergic reactions maybe to the materials that are being used to administer the PRP. For example, maybe the alcohol, iodine, plaster, and the bandages. You may have allergies to the materials, but typically people don't have allergies to the PRP because remember, that is your own blood that you are re-injecting into the joint. So what should you do before and after a PRP injection? So before doing a PRP injection, you would want to stop your anti-inflammatory medications around 5 to 7 days before. So if you're taking medications such as diclofenac, you may want to discontinue that 5 to 7 days before doing the PRP. In terms of pain control, you can use paracetamol to control any sort of pain that you may be having in the knee before and after PRP. If you are on any aspirin or anticoagulants for any other medical condition, for example, a heart condition, you have to stop that on your own. You have to discuss that with the primary doctor that recommended those medications in the first place. Discuss with the doctor. You tell the doctor that you intend to do a PRP injection and see if it is safe for you to stop those medications for a short period of time. So once again, that's a word of warning when it comes to anticoagulants like aspirin, because remember, a lot of these medications are recommended because a person may have a heart condition, they may have a stroke, and then your primary doctors put you on those medications. So you're not to stop those medications on your own before doing a PRP or after the PRP. A lot of times a person can still be on anticoagulants and safely do the PRP, but again, discuss that with your primary doctor. And if it is okay for you to stop those medications for a couple days, then you can do it, and then you can restart as directed by the primary doctor. Also, make sure you are well hydrated the day before. Drink a lot of water, and on the day itself, it does help with the blood draw when you are well hydrated. Also, you are to avoid heavy alcohol use 24 to 48 hours before the procedure and 1 week after the procedure. The reason for this is alcohol does tend to inhibit the healing mechanism of the body, so you want to really maximize the effect that PRP is going to have on the joint. So you want to reduce alcohol or to remove alcohol totally, and for that period of time to allow the PRP to work properly and help to give you the best regeneration possible. In terms of physical activity after PRP, you will do what is called a relative rest. You're just going to do the daily activities necessary to maintain life, but you're not going to do any unnecessarily heavy activities such as going to the gym, doing any sort of hiking and any sort of sporting activities. You just really want to give the knee that best chance possible to heal, so you want to limit your activity to only what is necessary. So I also mentioned physiotherapy. Now, wait 1 to 2 weeks before engaging in physiotherapy. You would want to discuss with your physiotherapist what you did in the sessions, and you bring all of your medical reports, all of your x-rays, and let the physiotherapist look them over and then initiate therapy at the level that is appropriate for you. So after doing the PRP, there may be some soreness at the injection site, as well as you may still be experiencing some of the arthritis pain because the PRP does not work immediately. And of course, you would want to get some pain relief, and you may accidentally reach for your typical anti-inflammatory medications. You have to be very careful as to not to do that, because then you're going to counteract, you're going to oppose the PRP from working in the knee. Remember, you want a good inflammatory process in the knee from the PRP, and you don't want to fight against it with medications that are anti-inflammatory. So again, paracetamol, tramadol, these sort of medications can be taken because these are non-anti-inflammatory painkillers. Now, with any medical procedure, there are risks, and you should know when an emergency is occurring. So if after you've done the PRP and then you begin to experience fever, chills, the knee joint is getting very warm, very hot, very red quickly, as well as it feels very stiff, if it looks swollen, of course, if there's a escalating pain beyond what would be reasonable pain, in that case, you may need to get to the health center or the hospital to have the knee examined and possibly drained. Also, what you can look out for, it's calf pain or calf swelling, as well, and possible shortness of breath. This is rare, but you also need to be aware of it, because sometimes when you do any sort of medical procedure in the leg, there's a risk of possibly blood clots forming in the calf muscle, which can then lead to these symptoms. So you need to know when it is you need to get to the emergency room to deal with any particular condition you're having concerns about. So how does PRP compare with cortisone or steroid shots and the gel shot? Now, with the cortisone or the steroid shot, what that does, that is a purely anti-inflammatory procedure. So when you inject the steroid or the cortisone, it reduces the inflammation in the knee and helps you to be more comfortable. It reduces the pain. However, it does nothing to repair or cushion the joint. Additionally, if you do too much steroid shots, it may actually thin out the cartilage. And steroid shots are not to be done more often than once every 3 to 4 months. Additionally, if you have uncontrolled diabetes or uncontrolled blood pressure, you're not to be doing the steroid shot. Now, you can be a diabetic or hypertensive, but if the conditions are well controlled, you can do the steroid shots. So PRP aims to do some sort of repair. Steroid is not about repair, it's just really about bringing down the inflammation and reducing the pain. In terms of the gel shot, now the PRP is really more targeting the cartilage to help to rebuild the cartilage to some degree. The gel shot is not about the cartilage. Gel shot is about putting in a lubricating fluid, or a lubricating and a cushioning fluid in the knee joint, allowing the movement to be more comfortable. So that is how the gel and the PRP are different. Additionally, you know the PRP is from your own blood. However, the gel, it is made from bacteria in a lab. So that's the difference. The PRP is in your own blood. The gel is made from a bacteria in the lab. So that is how the PRP, the steroid shot, and the gel shots would compare. So to determine which one is right for you or which one is best for you, it's always best to have a consultation. You do the x-rays for us to see the degree of arthritis you have in the knee joint, as well as to what are your goals, if you intend to play sports, if you intend to be a bit more sedentary. All of these factor in as to which will be the best one for you, as well as to their cost is also a factor. So all of these issues I discussed to come to a proper decision as to which shot you should be taking. So I hope you enjoyed that video on PRP for knee arthritis questions and answers. If you have any questions, you can send your x-rays to 747-5297 or 308-3370. We are located at number 4 Chincuna Gardens in Chincuna Road, Cunupia.